Hello, hello, hello. Welcome to Florida Training Career Academy. My name is Phyllis, and I will be your instructor for tonight. This evening, I'm sorry, we'll be managing pediatric emergencies. So, welcome everyone. Welcome. All right, we'll go ahead and get started here. A 5-year-old is brought to the ER after being hit by a car. They have a suspected spinal injury. What is the first thing you do? Let's go live. All right, question 1. A 6-year-old child is admitted with second-degree burns on the arms from a fire. What is the priority action? Is it A, apply antibiotic ointment, B, cover the burn with a clean, dry cloth, C, apply cold water to the burn for 30 minutes, D, remove the clothing stuck to the burn? Okay. Hello. All right, let's go ahead and see what the answer is. If you chose B, you are correct. Cover the burn with a clean, dry cloth. The rationale is the priority in managing burns is to protect the area and prevent infection. Applying cold water or ointments can cause hypothermia and damage the tissue further. All right. Hello, you guys that are just joining. Hello. All right, let's go ahead and move along to question number 2. A child who fell off a skateboard and hit his head is unconscious for a few minutes. What is the most important next step? All right, I'll give you a few seconds to answer. Is it A, monitor for headache, B, apply an ice pack to the child's head, C, allow the child to rest, D, call 911 immediately? All right, let's see what answers that we have coming in. Get those answers in, you guys, ladies and gentlemen. All right, I'm going to go ahead and reveal the answer. The answer, if you chose answer D, you are correct. Call 911 immediately. Loss of consciousness after a head injury indicates a possible serious traumatic brain injury. Emergency services must be contacted immediately for further evaluation. All right, moving right along. All right, a 5-year-old has fallen from a playground and has a visible deformity on the arm. What is the first action to take? Is it A, attempt to realign the bone, B, elevate the arm, C, immobilize the arm with a splint, D, give the child water to drink? What do we have? All right, let's get those answers in the chat. I see some C's, D's. What do we have? All right, see some C's. All right, I'm going to go ahead and reveal the answer. If you chose answer C, you are absolutely correct. A thumbs up to you guys. Immobilize the arm with a splint. Immobilizing the injury helps prevent further damage until professional medical help is attained. Realignment should only be done by trained medical professionals. All right, moving right along. All right, a toddler is brought in after near drowning in a pool. What is essential in post-drowning care? Is it A, administer bronchodilators, B, provide food and fluids, C, monitor for respiratory distress, or D, encourage coughing to clear the water? Give you a few seconds to go ahead and put those answers in the chat. Do we have A, B, C, or D? What is your answer? Place it in the chat. All right, I'm going to go ahead and reveal the answer. All right, here we go. If you chose answer C, way to go, you are absolutely correct. Monitor for respiratory distress. Drowning can lead to lung injury and secondary drowning, basically delayed respiratory distress, which may occur after the incident, requiring close observation. Coughing, while helpful, might not clear up the fluids that have accumulated in the bases of the lungs. All right, if you chose C, way to go, way to go. You find a 3-year-old unresponsive with no breathing. What is your next step? Is it A, deliver 30 chest compressions? B, begin rescue breathing immediately? C, call 911 and get an AED? D, open the airway and check for foreign objects. All right, give you a few seconds to get those answers in the chat, ladies and gentlemen. Let me know what your answer is in the chat. Okay, I see some coming in. Okay. All right, I'm going to go ahead and reveal the answer. Here we go. All right, if you answered number C, you are absolutely correct. Call 911 and get an AED. In pediatric emergencies, calling for emergency help in an AED is the priority before beginning CPR. Rescue measures should after calling for help. Way to go, you guys. All right, a 4-year-old child has burned from hot liquid over 20% of their body. What is the initial priority for treatment? Is it A, pain management, B, fluid resuscitation, C, nutrition status, D, wound debridement? Give you a few seconds to get those answers in the chat. What do we have? Let's get those answers in the chat. All right, I'm going to go ahead and reveal the answer for you. Here we go. If you chose B, give yourself a pat on the back, you are absolutely correct. Fluid resuscitation. Burns covering significant body areas can lead to fluid loss and shock. Fluid replacement is critical to stabilize the child. Once stabilized, the healthcare team can focus on managing the child's pain. Way to go, guys. A 7-year-old is in respiratory distress after a severe asthma attack. What should be done? What should be the priority treatment? Is it A, administer a cortisol? B, place the child in a supine position? C, provide oxygen via a face mask? D, use a short-acting bronchodilator, albuterol. All right, give you a few seconds to go ahead and get those answers in the chat. Get those answers in the chat. All right, I'm going to go ahead and reveal the answer. If you chose D, you are absolutely correct. Use a short-acting bronchodilator, basically albuterol. Albuterol is a bronchodilator that works quickly to relieve asthma symptoms by relaxing the muscles in the airways, providing immediate relief. All right. After a motor vehicle accident, a child is in shock. What sign is most concerning? Is it A, tachycardia, B, cool, clammy skin, C, blood pressure 70/40, or D, restlessness? Let's get those answers in the chat. Let's see what you guys got for me. Come on and get those answers in for me. All right, I see you. All right, I got some A's and C's. I got B's. What else do we have? B's. All right, I'm going to go ahead and reveal the answer. If you chose answer C, you are absolutely correct. Blood pressure 70/40. Hypertension in a pediatric patient is a late and serious sign of shock. Immediate interventions are necessary to stabilize blood pressure. All right, you guys, way to go, way to go. If you're just not joining, welcome, welcome, welcome. When performing CPR on a 5-year-old, what is the correct depth for chest compressions? Is it A, about 1 inch, B, at least 1.5 inches, C, about 2 inches, D, at least 3 inches. What do we have? What do we have? Come on, let's get those answers in the chat. Okay, I see some C, B's. What else we got? Some C's. All right, C's. All right, I'm going to go ahead and reveal the answer. If you chose C, you are absolutely correct, about 2 inches. The recommended depth of chest compressions for children in CPR is about 2 inches to effectively circulate the blood. Way to go, you guys. Thumbs up. A 6-year-old involved in a bicycle accident has an open leg fracture. What is the priority action? Is it A, irrigate the wound with sterile water? B, apply a tourniquet above the fracture? C, apply pressure to the fracture site? D, stabilize the leg with a splint? Give you a few seconds to get those answers in the chat, ladies and gentlemen. Get those answers in the chat. Oh, excuse me. Get those answers in the chat for me. All right. I am going to go ahead and reveal the answer. If you chose D, way to go. Stabilize the leg with a splint. Stabilizing an open fracture minimizes the risk of further injury or pain. Irrigation or pressure application should be left to medical professionals. Way to go, you guys. A child is choking on a piece of candy and unable to cough. What is your first action? Is it A, perform back blows? B, begin abdominal thrust, the Heimlich maneuver? C, encourage the child to cough harder? Or D, give the child water to drink? What do we have? I'll give you guys a few seconds to go ahead and put those answers in the chat. All right, I see some D's coming in. A. All right, what else we got? Give you a few more seconds. All right, give me about one more answer. All right, I'll go ahead and reveal the answer now. If you chose B, way to go. Begin abdominal thrust, the Heimlich maneuver. For a conscious child with a complete airway obstruction, abdominal thrusts are recommended to dislodge the object. Way to go, you guys. You guys are doing all awesome tonight. Way to go. A 2-year-old ingests an unknown amount of cleaning fluid. What is the most important intervention? Is it A, induce vomiting? B, give the child water? C, administer activated charcoal? D, call poison control? I'll give you a few seconds to go ahead and get those answers in the chat. What do we have? All right, let's see. All right, I see C. Okay, I see D. Give me one more and I'll go ahead and reveal the answer in the chat. All right, if you chose D, you are absolutely correct. Call poison control. Poison control provides specific instruction based on the ingested substance. Inducing vomiting can be dangerous in certain poisoning cases. All right, you guys, good job. A 4-year-old presents with respiratory distress and in respiratory stridor. What should be the initial action? A, perform CPR. B, administer epinephrine. C, place in a prone position. D, provide humidified oxygen. All right, let's see what answers are you guys going to give me in the chat. What do you think it is? A, B, C, or D? What do we have? All right, guys, put those answers in the chat. What do we have? What do we have? All right, a few more seconds, and I'm going to go ahead and reveal the answer for you. All right, if you chose D, you are absolutely correct. Provide humidified oxygen. A respiratory stridor indicates upper airway obstruction. Humidified oxygen helps to ease breathing by reducing inflammation and moist loss. All right, you guys are doing Good. Way to go. Way to go. All right. Question. You are teaching parents about skateboard injury. What is the most important safety recommendation? Is it A, use elbow pads, B, skate on smooth surfaces, C, wear a helmet at all times, D, avoid skateboarding in the evening? All right, gonna give you a few seconds to put those answers in the chat. Is it A, B, C, or D? What do we have? All right, I see some C, D's. All right, what else do we have? A few more seconds and I'll go ahead and reveal the answer. All right, and the answer is, if you chose C, you are absolutely correct. Thumbs up to you guys. Wear a helmet at all times. Head injuries can be life-threatening. Wearing a helmet is crucial in preventing traumatic brain injury during falls. All right, way to go, you guys. A 5-year-old is brought to the ER after being hit by a car. They have a suspected spinal injury. What is the first action? Is it A, log roll the child to examine their back? B, stabilize the neck and spine? C, check the child's temperature? D, assess for head injuries? What do we have? Put those answers in the chat, ladies and gentlemen. What is your answer? A, B, C, or D? All right, I'll go ahead and reveal the answer. If you chose B, thumbs up. You are absolutely correct. Stabilize the neck and spine. In cases of suspected spinal injury, immobilizing the spine is the priority to prevent further damage, especially before moving the patient. So if you chose B, way to go. A child is pulled from a lake. The child is pulseless and is not breathing. After calling for help, what is the next step? Is it A, begin rescue breathing? B, check for a pulse? C, start CPR? D, place the child in the recovery position? All right, let's get those answers in the chat. Is it A, B, C, or D? What do we have? All right, let's get those answers. I'll go ahead and reveal the answer. And if you chose answer C, thumbs up. You are absolutely correct. Start CPR. Starting CPR immediately on a pulseless child who has drowned is crucial because it helps restore oxygen to the brain and other vital organs, preventing permanent brain damage and improving the chances of survival. The compression to breath ratio for a single rescuer is 30 compressions followed by 2 breaths. All right, way to go on my C answers. A 4-year-old child presents to the ER with a forearm fracture. Which sign would indicate compartment syndrome? Is it A, cold extremities, B, increased pain unrelieved by analgesics, C, capillary refill less than 3 seconds, D, normal pulse? What do we have? What do we have? What do we have? All right. You guys go ahead and put your answers in the chat. Let me know if you think it's A, B, C, or D. All right, I'll go ahead and reveal the answer. If you chose B, you are absolutely correct. Increased pain unrevealed by analgesics. Compartment syndrome presents with severe pain that is out of proportion to the injury. It is a surgical emergency that requires immediately intervention. Way to go, guys. A 3-year-old is experiencing a febrile seizure. What is the first intervention? Is it A, administer anti-seizure medication? B, sponge the child with cool water? C, ensure the child is safe from injury? D, call 911 immediately. What answers do we have? A, B, C, or D? Put your answers in the chat. Let's see those answers. All right, I'll go ahead and reveal the answer. If you chose C, way to go. Ensure the child is safe from injury. During a seizure, the focus is on preventing injury. For example, move objects out of the way. After the seizure, further care can be provided, but the child should be protected first. Febrile seizures are convulsions triggered by a fever, typically occurring in young children. Treatment focuses on managing both the seizure and the fever. Example, Tylenol. Way to go, you guys. A child is unresponsive and not breathing. You start CPR, and after 2 minutes, an AED arrives. What is the next step? Is it A, continue chest compressions for another 2 minutes? B, attach the AED and follow the prompts? C, check for a pulse? D, repositions the child airways. What answers do we have? Put them in the chat. Put them in the chat. I'll go ahead and reveal the answer. If you chose answer B, way to go. Attach the AED and follow the prompts. Once an AED is available, it should be used immediately to determine if a shockable rhythm is present. Follow the prompts to continue care. Way to go, guys. A 2-year-old presents with a partial thickness burn on the chest from boiling water. What should be included in the initial management? Is it A, apply ice to the burn? B, pop any blisters that form? C, cover the burn with a petroleum-based ointment? D, run cool water over the burn. All right, let's get those answers in the chat. What do you guys think it is? A, B, C, or D? All right, I got some A, B, C. What else do I have? I have the alphabet, A, B, C, D. All right, I'll go ahead and reveal the answer. If you chose D, you are absolutely correct. Run cool water over the burn. Cool water helps to stop the burn progression and ease the pain. Ice should be avoided as it can cause further tissue damage. All right. A 6-year-old child fell off a slide and now has difficulty breathing and visible bruising on the chest. What is the most concerning complication? Is it A, fractured rib, B, pneumothorax, C, abdominal trauma, D, bruising? What do we have? What do we have? Okay, I'll go ahead and reveal the answer. If you chose B, you are absolutely correct. Pneumothorax. When a fractured rib punctures a lung, it can lead to a serious condition called pneumonia thorax. I'm sorry, I pronounced it wrong. Pneumonia thorax. Collapsed lung, basically a collapsed lung. All right, you guys are doing great. You guys are doing great. Which age group has the highest risk for drowning? Is it A, 1 to 4 years, B, 5 to 9 years, C, 10 to 12 years, D, 13 to 18 years? All right, let's get those answers in the chat. Do you guys think it's A, B, C, or D? What do we have? What do we have? What do we have? All right, I'll go ahead and reveal the answer. If you chose A, thumbs up, way to go. 1 to 4 years is the correct answer. Toddlers and young children are most at risk for drowning because they are mobile but lack awareness of water hazards. Constant supervision is essential. Way to go, you guys. A child with respiratory distress shows nasal flaring and intercostal reaction. What is the priority action? Is it A, administer albuterol, B, check oxygen saturation, C, provide high flow oxygen, D, place the child in a prone position? Let me know what your answer is. Is it A, B, C, or D? Let's see what we have. A, B, C, or D. All right, I'll go ahead and reveal the answer. If you chose C, way to go. Provide high flow oxygen. Nasal flaring and retractions indicate significant respiratory distress. High flow oxygen should be administered immediately to improve oxygenation. All right, you guys, way to go. Thumbs up. Give all you guys, give yourself a pat on the back. If you have the correct answer or didn't have the correct answer, at least you gave it a try. Way to go, you guys. A child presents with a third-degree burn from fireworks. Which of the following should be avoided in severe burn care? Is it A, fluid resuscitation, B, applying antibiotic ointment, C, covering with a sterile dressing, D, applying cold water for pain relief? Put your answers in the chat. Is it A, B, C, or D? Let me know what you think it is. Let me know. A, B, C, or D. All right, I'll go ahead and reveal the answer. If you chose D, way to go, thumbs up. Applying cold water for pain relief. For deep burns, third degree, applying cold water can increase the risk of hypothermia and shock. Focus should be on preventing infection and fluid resuscitation. Way to go, you guys. A child has been struck by a car and presents with an open wound and signs of internal bleeding. What is the most immediate concern? Is it A, infection, B, hypovomic shock, C, dehydration, D, pain management? What do you think it is? A, B, C, or D? A, B, C, or D? Place it in the chat for me. Place it in the chat. If you don't know it, or just give it a try. Give it a try. That's all you could do. Give it a try. Give me an answer. All right, let's see what we have. If you chose B, you are absolutely correct. Way to go. Hypovomic shock. Internal bleeding can lead to hypovomic shock, which is life-threatening. Life-threatening. Immediate treatment to stop bleeding and restore fluids is crucial. Way to go, you guys. During a pediatric emergency, how often should rescue breaths be given if the child has a pulse but is not breathing? Is it A, every second, B, every 2 to 3 seconds, C, every 5 to 10 seconds, D, every 10 to 12 seconds? Put your answers in the comment and please let me know what you think the answer is. Is it A, B, C, or D? What do you guys think it is? All right, I'll go ahead and reveal the answer. If you chose B, way to go, every 2 to 3 seconds. In pediatric CPR, rescue breath should be delivered every 2 to 3 seconds or 20 to 30 breaths per minute if the child has a pulse but is not breathing, based on current American Heart Association guidelines. Way to go, you guys. A 10-year-old child presents with a skateboard injury and a suspected broken leg. What is the first action? Is it A, apply heat to the area, B, give ibuprofen for pain, C, immobilize the limb, D, elevate the leg? Put your answer in the comment for me. What do you think it is? All right, I'll go ahead and reveal the answer. If you chose C, way to go, immobilize the limb. The first step is managing suspected fractures, is immobilizing the affected limb to prevent further injuries. Way to go, way to go, way to go. What is the correct rate of chest compressions during CPR for children? Is it A, 60 compressions per minute, B, 80 compressions per minute, C, 100 to 120 compressions per minute, D, 140 compressions per minute? Put your answer in the chat, ladies and gentlemen. Let me know what you think it is. A, B, C, or D. If you don't know the answer, still give it a try. Let me know what you think it is. Place your answer in the chat. All right, and the correct answer is C, 100 to 120 compressions per minute. Chest compressions during pediatric CPR should be performed at a rate of 100 to 120 per minute to ensure adequate circulation. Way to go, guys. Way to go. A 3-year-old presents with respiratory distress following an allergic reaction. Which is the priority medication? A, albuterol, B, diphenhydramine, C, epinephrine, D, steroids. I'm sorry, corticosteroids. Which one? Is it A, B, C, or D? What do you think it is? If they are having an allergic reaction, place your answers in the chat. All right, let's go ahead and reveal the answer. All right, if you chose C, epinephrine, you are absolutely correct. Epinephrine is the first line treatment for anaphylaxis, rapidly reversing airway swelling and respiratory distress. Way to go. A 12-year-old who was hit by a car has a rapid weak pulse and is pale and sweating. What should be the first intervention? Is it A, check for broken bones, B, elevate the child's leg, C, provide oral fluids, D, call 911 and monitor vital signs? What do you think it is? A, B, C, or D? All right, all right. All right, you guys, go ahead and reveal myself. Hi, you guys. Hi, hi, hi. All right, let's go ahead and see what the answer is. If you chose D, you are absolutely correct. You will call 911 and monitor vital signs. These are signs of shock. Calling emergency services and monitoring the child's vital signs is the priority. Way to go, you guys. Thumbs up. Way to go. Sorry about that. I thought I hit the button. A child suffers a first-degree burn after pulling a hot pan from the stove. How should the burn be initially treated at home? A, apply butter to the burn. B, use ice to cool the area. C, cover the burn with a wet cloth. C, run cool water over the burn. Let me know what you think it is. Is it A, B, C, or D? What should you do at home first? All right, go ahead and let me know. Get those letters in the chat. Let's get them rolling in. All right, let's see what the answers is. If you chose D, give yourself a thumbs up. You would run cool water over the burn. Running not cold water, over the burn for several minutes can help reduce pain and stop the burn from progressing. Way to go, guys. Way to go. Okay, let's see. A 7-year-old has fractured their arm after falling from the tree. After immobilizing the arm, what is the next step? Is it A, apply ice to the injury? B, encourage movement to reduce stiffness? C, elevate the arm and monitor circulation? D, give the child something to eat or drink? What do you think it is? A, B, C, or D? Let's go. Let's go. Get those answers in the chat, ladies and gentlemen. All right. Let's go ahead and reveal the answer. If you chose C, you are absolutely correct. You will want to elevate the arm and monitor circulation. Elevating the injured limb helps reduce swelling, monitoring for changes in circulation. So the color, the warmth, and sensation is important to assess for complications like compartment syndrome. All right, let's go ahead to the next question. A child has suffered a severe burn to the leg. Which of the following is the most important intervention upon arrival to the hospital? Is it A, debriding the wound, B, initiating fluid resuscitation, C, administering pain medication, D, applying antibiotic cream? What do we have? A, B, C, or D? All right. See some C's. Let's get them rolling in. Get them rolling in. All right. Let's go ahead and reveal the answer. If you chose B, way to go, initiating fluid resuscitation, significant burns cause fluid loss and can lead to shock. Fluid resuscitation is an essential in maintaining hypodynamic stability. Way to go, you guys. Give yourself a round of applause so far, whether you tried, whether you got it right or wrong. Way to go. All right. A 5-year-old is hit in the abdomen during a football game. The child is now vomiting and complaints of severe stomach pain. What complication are you most concerned about? Is it A, appendicitis, B, internal bleeding, C, muscle strain, D, bowel obstruction? Let's get those answers in the chat. Is it A, B, C, or D? Let's see what we have. A, B, C, or D. If you chose answer B, way to go, internal bleeding. Abdominal trauma, especially with vomiting and pain, raises concerns for internal bleeding, which can be life-threatening and requires immediate medical evaluation. Way to go, you guys. Way to go. A 9-year-old is in respiratory distress after a near drowning incident. Which assessment finding would be most concerning? Is it A, oxygen saturation of 94%, B, wheezing and accustulation, D, productive cough with clear sputum, D, shallow breathing and lethargy? Which one do we have? A, B, C, or D? All right. I see some B's, B's, B's. All right. Let's go ahead and reveal the answer. If you chose answer D, way to go. Shallow breathing and lethargy. Shallow breathing and lethargy indicate respiratory fatigue and possible respiratory failure, which is a critical complication after drowning. All right. What is the correct placement of AED pads on a child under 8 years old? Is it A, one pad on the upper right chest and the other on the lower left side? B, one pad on the chest, one pad on the back? C, both pads on the chest? D, one pad on the upper left chest and the other on the upper right chest? What do we have? A, B, C, or D? A, B, C, or D? All right, ladies and gentlemen, let's go ahead and reveal the answer. If you chose B, you are absolutely correct. One pad on the chest, one pad on the back. For children under 8 years old, the AED pads are typically placed with one on the chest and one on the back to ensure effective defibrillation. Way to go, guys. I'm proud of you. Proud of you. Giving all you guys a round of applause for at least putting an answer in there, whether it was right or wrong. Way to go. You find an infant who is choking and unable to cry or breathe. What is the first action you should take? A. Perform chest compressions. B. Start abdominal thrusts. C. Administer 5 back slaps followed by 5 chest thrusts. D. Attempt to remove the object with your finger. Let's get those answers in the chat, you guys. Let's get those answers in the chat. What do we have? If you chose answer C, you are absolutely correct. Administer 5 back slaps followed by 5 chest thrusts. For a choking infant, the correct intervention is alternating between back slaps and chest thrusts to try and dislodge the object. Yep, that is answer C. Way to go for all the C answers and for the ones that tried. A 3-year-old falls from a high chair and is drowsy with vomiting. What is your priority action? A. Let the child rest. B. Call 911 and monitor the child's airway. C. Give antihistamine for the headache. D. Monitor the child for the next 24 hours. What would you do? A, B, C, or D? Put those answers in the chat. All right. Let's go ahead and reveal the answer. If you chose B, way to go. You would call 911 and monitor the child's airway. Drowsiness and vomiting after a fall indicate a possible head injury. Immediate medical attention is required and the airway must be closely monitored. Way to go, you guys. A 5-year-old child is unresponsive after a fall. You are unsure if they are breathing. What is your next action? Is it A, call for help, B, check for a pulse, C, open the airway and check for breathing, D, start CPR immediately? Put your answers in the chat. A, B, C, or D. What do you think the answer is? All right, I'll go ahead and reveal the answer. If you chose C, you are absolutely correct. You will open the airway and check for breathing. Opening the airway and checking for breathing is critical before starting CPR. If the child is not breathing, you should begin CPR. All right. Doing CPR on a 6-year-old, what is the correct compressions to breath ratio with 2 rescuers are present? Is it A, 15 compressions to 2 breaths, B, 20 compressions with 2 breaths, C, 30 compressions with 2 breaths, or is it D, 10 compressions with 2 breaths? Let's get those answers in the chat. Let's see. What do we have? Is it A, B, C, or D? All right, and the answer is, if you chose answer A, you are absolutely correct. 15 compressions to 2 breaths. For 2 rescuer CPR on a child, the recommended compressions to breath ratio is 15 to 2 to ensure better circulation and ventilation. Way to go, you guys. All right, you guys, my name is Phyllis McClendon. I have been your instructor for tonight. Thank you for watching, and you can always comment, like, share, or subscribe at www.floridatraining.com. Do any of you guys have anything that you would like for us to do next? Please place it in the comments, and we will try to prepare a slide for you for that topic. Don't forget, please comment, like, and share, and subscribe. Once again, my name is Phyllis McClendon. It was a pleasure speaking with you guys this evening. You guys have a good night.